So vestibular processing difficulties, space issues, difficulty judging distances. So that sort of classic example is the child who stands too close, doesn't have understanding of where they end and you begin. A little boy that I worked with several years ago, and something I've replicated over and over again, almost 12 years old, and his mom's big concern was that he was always on her when he's talking to her, and didn't have an understanding of the fact that they're two different beings, and they have. And what's interesting about that when you look at space issues and with children and development is, as parents, we don't register kids in our space. Our children aren't registered in it. They say that your nervous system has a space, your tactile system has a space, but we don't register our children in our space until they get older. So we don't even know enough to tell them, oh, you need to back up now, until they start to get older. It's really fascinating, actually, when you look at our tactile systems, how different countries have different amounts of space that they consider part of their nervous system. And ours is pretty big. We have a pretty big space around us that we require. But with our kids, we don't. So now this little guy, though, is big, and his mom was really concerned because he didn't get the space issues with her, with other people. He was never sure. Even how loud he talked, all that was played into it. And he had a diagnosis of Asperger's syndrome. So he definitely had some vestibular processing difficulties, which we started to address with getting him more vestibular input, low tone kind of kiddo. But do you think if we got him vestibular input, and quite a bit of it, we would see that behavior change? Yeah. Bingo. So what has he already learned? He's already learned this. So again, that nervous system was the driver, probably the vestibular processing deficits for him, or vestibular processing dysfunction. But the learned behavior of how he, where he stood, and understanding of where he ends and someone else begins, or understanding of that arm's distance, was not there. And even the visual or the verbal prompt of arm's distance doesn't really work if the nervous system isn't getting it, right? So what we did with him is we had one of those small circles, so not a hula hoop size, but smaller, and he stood in it, and we had another child his age enter that circle and ask him if he wants to go play. And this is what we saw. Now this is the child who didn't get the space issues. He's like, no, he's too close, he's too close, he's too close. So then we could say, okay, take a step back and do it again. It was about 4 steps back where he said he felt comfortable. So interesting, and I've done this over and over again now with kids who have space issues when in social situations, because this is the space he owned. So when someone else came into that space, it made he experienced how uncomfortable it was. But what he's used to doing is going into other people's space. So we then could say, well, that's about arm's distance. And we did that several times and talked about how that experience made him feel and how other people feel the same way. And then he could get that. But he had to have the experience with the visual, with the language, to really understand that. At the same time, we're supporting that foundation system, right? We're getting the input to that foundation system, that vestibular system.